Hello, my name is Sutopo Patriajati. Me and my team are Ayun, Sriatmi, and Arnia, Dian, Kusuma, Devi from Health Policy and Administration Department of Public Health Faculty, Diponegoro University. We would like to present our paper about students' compliance in doing physical activities during COVID-19 pandemic, especially in Central Java. As we know, the beginning of July 2020, the cumulative number of COVID-19 cases in Indonesia have reached more than 57,000 cases, with a death almost 3,000 deaths. Based on the data in the age of group of 9 to 17 years old or in the school age of group, there was a positive COVID-19 of 5.7% or around more than 3,000 people, with a death of 0.6% or a total almost 18 people's death. The COVID-19 pandemic had a significant impact on many sectors of people's lives, one of which was the education sectors. Physical distancing policy is also implemented in the education environmental through effort to eliminate activities in school. It aims to break the chains of transmission of the virus and struck the curve of COVID-19 cases. The Minister of Education and Culture issues Circular number 4 of 2020, one of which points to the educational activity in the coronavirus disease emergency period carried out by online methods from home. The social physical distancing policy implemented by governments to prevent transmission of COVID-19 for school-age children to carry out various activities at home. Quarantine demands and online models of learning had an impact on children's tendency to static patterns through sitting, playing, gadget, eating, and sleeping. They also neglecting important physical activities that must be carried out to maintain stamina, growth, and health status, such as light exercise and sunbath in the morning. The purpose of the study was to analyze the compliance of students from doing physical activities during COVID-19 pandemics and various influencing factors. The method of the study involved 167 people with inclusion criteria, namely children who live in Central Java Province, aged 10 to 90 years, and are still in school or student status. This study used closed questionnaire instrument using Google Form due to the COVID-19 pandemic situation. The independent variables of the study include characteristic, knowledge, attitudes, perception of social distancing policy, perception of social impact, family support, perception of mental vulnerability, communication, comfort, and physical health status. The dependent variable is compliance in carrying out physical activities as measured by indicators of sport activities and sunbathing in the morning. Data were analyzed univariately with frequency distribution and bivariate analysis with cross tables and rank Spearman correlation tests because the data were not normally distributed. Okay, now it's your turn, Mrs. Ayun. Thank you.
The result of studies shown that as many as 61.7% of students have good levels compliance in doing physical activities. The low differences between the proportion of children with a heavy mental vulnerability compared with the low indicates that the COVID-19 pandemic raises two different dimensions of understanding. In community, some children feel more depressed, confused, and stressed with this situation. But on the other hand, some children feel more happy because they could play freely and anytime. They were bound, they were not bound to go to school and not doing their work. The same relative conditions also occurs in the perception variable of social impacts they felt during the COVID-19 pandemic. With the rank Spearman test, we all know that variables of family support, communications, and people interactions, perceived of comfort, and physical health status were shown partially to be positive correlated with adherence in doing physical activities, p-value lower than 0.05. But variable of age, sex, education, family status or economic status, knowledge, attitude, perception of social and physical distancing policies, social impact perception, and variables of mental vulnerability were not related to the compliance of students in doing physical activities during COVID-19 pandemic. Thank you.
The last part is the conclusion. The study indicates that family support, ongoing communication, comfort, and physical health status show a significant correlation with school children's compliance with physical activities. Support and involvement of family members to jointly carry out physical activities on a regular basis could be done through intensive communication with parents that always invite and remind them to do exercise. Health workers could monitor and evaluate it by involving the role of school teachers. That's all from us. Thank you.